Hello, everybody. On behalf of Filmate team, I'm very happy to welcome you tonight to this webinar with my dear colleague and friend, Dr. Ricky Smith from Pretoria, to present you optimized energy-based device outcomes through cellular biohacking, the role of NCTF in tissue conditioning. Maybe you have seen this symposium during MClass. Nevertheless, here we will go in depth to better understand what's happened and the need of NCTF to prepare conditioning. Next. So, energy delivery is controlled, but tissue response is conditioned. So we want to understand what drives variability in energy-based device outcome. Next. Why do identical energy deliveries lead to different healing outcomes? Because the device parameters can be precisely standardized, but yet clinical recovery and tissue response remain variable. And this variability reflects the difference in baseline of the tissue condition. Healing trajectories are biologically driven. The question is, can we influence this trajectory? Next. This webinar will try to answer. So first, we will see why cellular biohacking impacts energy-based device results. Then, the role of NCTF 135HA in cellular biohacking. Then, the scientific evidence supporting biohacking. And then, at the end, how impact on energy-based device outcomes. So, I want to present, if needed, my dear colleague and friend Ricky Smith, that is aesthetic practitioner in South Africa. The experience of NCTF is more than 22 years, and she already has a big platform in her clinic for many energy-based devices. Thank you, Ricky, to be here with us tonight and share all of your experience of energy-based device using NCTF before and after. Ricky, stage is yours.
Sorry. Thank you very much, dear Valerie, and I'm really very happy to actually share this information because it's something that is really very important for me because I've been working with this for so many years. And I've seen a lot of different things that can go wrong and that can go right with energy-based devices. So I'm really happy to be able to share this information with you. I just want to check, can you see my screen? Because I saw it was just sharing the window. Can you see the screen?
We can, Ricky.
Okay.
We can, yeah.
Okay, so what I want to share with you is not just about how energy-based devices work.
Ricky, stop a moment because I think your screen is blurry. Can you guys confirm this is blurry on your side? We can't see clearly, Ricky.
Okay.
Okay. So if that's the case, that's not an issue. We can share on our side, yeah. Ricky, if you don't mind. Okay. So yes, Chanel, you can continue sharing, and Ricky, you say next when you want to skip the slide. Okay, no problem. Okay. No problem at all. Let's go.
Okay, so what I really want to share with you is how we can actually ensure that we get very, very good results on energy-based devices. And this is a very important aspect. So what we've termed this aspect is cellular biohacking. So a lot of you would be very familiar with the terms of biohacking. Biohacking is something that is very well known in regenerative medicine. It's very well known in the longevity circles. It's used in many other fields, such as orthopedic medicine and sports medicine. It's also very big now, the biohacking, to see how they can optimize athletes to be in the most optimal condition and to have better recovery. So what we're going to present to you today is how we can do cellular biohacking. Now, what does biohacking really mean on a cellular level and other levels? So biohacking refers to that we actually optimize the condition. So we're going to optimize the cells. Then we want to get longevity. So we want the cells to live longer, to be younger and live longer. And then very important is control. With biohacking, the whole healthcare model is moving away from a reactive model to a proactive model that we want to prevent. And this is the whole concept with cellular biohacking. It's conditioning, restoring, and optimizing the cellular function. And this is really done to improve the tissue response to all of our aesthetic procedures. So we can almost see it like you want to train your soldiers before they go to war, or an athlete that wants to train before they continue with an event.
You have to so that we move to the next slide, please, because you can't do it on your side.
Yes, next slide, thank you. So what we see in clinical practice is that we have very standardized techniques, whether it's energy-based devices or whether it's whichever treatment we're doing. But what we still notice is that we see variable healing time. We see some people healing very quickly, others don't have good healing. Then we see some of those patients where you do a laser and 1 week later they're still red and still inflamed and not healing well. We also see those cases of unpredictable fibrosis, such as scar formation or an area that didn't heal very well. And then very important is the pigmentation problems, that a lot of people are very afraid of lasers or energy-based devices because they're so afraid the pigmentation will worsen or they would get hyper or hyperpigmentation. So there's a lot of differences in the results, not just in how long the results last, but in all of the side effects that we can get. And some patients will get very good results and others not so good. And why does this happen? It's got to do with, did we really optimize the cells before we attack them? Did we train the soldiers before we send them to war? We can go to the next slide. So the whole concept here is that we know now that healing can be variable. There's a lot of variability. There are many, many publications on that, like dry tissue, very hydrated tissue. We know there's a lot of differences in healing between a young skin or an old skin, a very stressed skin with a bad skin barrier. So the devices are really good, but they do not control the biology. They do not control which person will have a better result. And what we see from the devices is the optimal results. In the brochures and the marketing, they show the best results, but they don't show you those patients that don't have good results. And those are the patients that we see in practice. They say, but my results are not like the pictures that they saw on the internet, on social media, on the brochures. And then they're very unhappy. And we want to minimize those amount of patients that are unhappy with suboptimal results. Next slide. So we know now that the techniques can be very standardized. What the techniques cannot control is we cannot control the individual inflammatory response because there's a lot of differences, a lot of factors, obviously. The redox balance, and then the extracellular matrix, the response of the extracellular matrix and the plasticity of it. And then the healing trajectory, like how quick they would heal, how fast they would heal, and what would be the outcome. So identical technical input. So you've got identical settings that you use on one person has a totally different response in another person. That's due to the differences in the biological cascades. And this is what we want to try and see. Can we actually control this and take it back in our hands and have a better outcome on all our patients? Next slide. So the whole concept is about we are doing an intervention that is attacking the cells. And we talk a lot about this inflammatory process. So we are doing an energy-based device or many other types of treatments to start this whole healing cascade. So we've got oxidative stress, we've got the acute inflammation, and the mitochondrial overload. We can compare this very much, and I always like to compare it because of my sports medicine specialty background to like an athlete. And I made this example also at the MCAS Congress symposium, where I said, if we take the majority of all of our people in the audience and we go and do a 100-meter maximal sprint, you like really go as fast as you can, then how many of you would have an injury? Many of you, because your cells are not optimized, your muscles are not ready for that impact. So that's quite the same effect. If we are treating a patient with already oxidative stress, already inflammation, and really mitochondrial overload, and we attack them with this aesthetic intervention, then we have really a very bad biological cascade and not a controlled wound healing process. Next slide. So to understand this type of thing, we need to understand the differences between competent tissue and aged or stressed tissue. So what is the difference between competent tissue? So competent tissue is very well hydrated. There's controlled inflammation. The metabolism of the cells are ready. The extracellular matrix is perfect. It's already there for regenerative healing. These are the tissues that we can attack with a surgery, with a laser, with needling, with whichever device, and we're going to have a good outcome. If we take on the opposite side, the stressed or the aged tissues, so this is your athlete that is not trained for the 100-meter sprint, and then we attack it, then we're going to get an injury. And this injury is going to take very long to heal because the muscle is not ready. You can see it very much the same as an athlete. If an athlete gets an injury, they heal actually very well. If a non-athletic patient gets an injury, they take very long for the muscles to heal. And this has also been shown, for instance, when they do surgery on top athletes, they heal miraculously, and then other non-athletic people don't understand how can they heal so quickly because the muscles were ready. So it's exactly the same with the skin. If the skin is optimal, it's ready for the attack and it can heal very well without any problems. Next slide. So the regenerative healing is really got to do with the cellular competence. And obviously we work a lot on the fibroblast and the function of the fibroblast with the whole metabolism and the inflammatory context. And this is what we're trying to biohack. Next slide. So all the responses that we get when we get stress is obviously the inflammatory response. So that's your redox balance. So the oxidative stress, the controlled inflammation. Remember, we want inflammation because inflammation at the end is really part of the wound healing cascade that leads to the whole process of collagen formation. But we don't want uncontrolled inflammation because a lot of doctors now say, okay, but should we then interfere with the inflammation because we'll get less collagen? But if you've got uncontrolled and prolonged inflammation, you have the opposite effect. You don't have the right type of collagen fibers that are forming, because remember, there's different collagen fibers, and it can be the end result of scarring with hypertrophic scarring or atrophic scarring. Then we need the mitochondria. Mitochondria is our energy, so it's ATP. We need it for the whole wound healing cascade. And then obviously the plasticity of the extracellular matrix. So that would be your collagen, elastin, and very important hyaluronic acid. That's very important for this tissue response under stress. Next slide. So the tissue quality makes a big difference, not just in the energy-based devices, but in the whole biological stress factor. The conditioned tissue environment is ready for this attack because it can manage the cellular response, it can manage the inflammation, and the end result would be the end of your wound healing cascade, which is more collagen formation and skin tightening, which we want to see with most of our treatments. If we then take a stressed tissue, we get disorganized extracellular matrix, and it's really a disorganized laying down of collagen fibers, which often leads to textural changes. The worst case would be scarring, but sometimes it's just texture that doesn't feel good. And then obviously prolonged inflammation leads to hyperpigmentation. Remember, the cause of most of our pigmentation is inflammation based. So if you've got uncontrolled and prolonged inflammation, the end result is pigmentation. So this is the reason why we do get hyperpigmentation after laser treatments in some patients, and it's regardless of their Fitzpatrick skin type. If the tissue is stressed and then we stress it even more, then it's too much inflammation that the skin cannot handle, and then we get hyperpigmentation. Okay, next slide. So remember your wound healing phases, and this is quite important to understand how we're going to do this biohacking. So the initial phase is now you've done, for instance, a CO2 laser. We get hemostasis, so the coagulation. Then we have for anything from 5 to 14 days, the inflammatory phase. So that's inflammation. So it's normal to be red. It's normal to be swollen. The more intensive your energy-based device, the more inflammation you will have. And then after 7 to 14 days, the inflammatory phase should go down, because otherwise the end result can either be pigmentation or scarring. But then as soon as the inflammatory phase goes down, we have the proliferative phase. So that's when the cells start growing. And obviously these cells cannot grow if they're not in a good environment. And the last phase is the phase that we like the most, which is the remodeling phase. And this is where we get new collagen. So this is quite important when I'm going to explain my protocol of how to incorporate the biohacking in your laser treatments. Next slide. So the biohacking zone works then on the physiological resolution and making sure that we don't have delayed or suboptimal healing, and making sure that we don't have fibrosis or dysregulated repair. So we don't want scar formation, we don't want prolonged erythema, we don't want pigmentation. And this is where we're going to work with this biohacking. Next slide. So what is the secret for the biohacking? And there's absolutely no better secret than NCTF 135HA, which Valerie is going to explain to us very much in detail as to why is this the secret to biohacking. And it was really beautiful when Dr. Michelle Torchman explained also at IMCAS Congress this year as well as last year, how we actually developed this wonderful product. And the product was developed to keep the cells alive in the laboratory and to give the cells everything that it needs to be in the perfect condition. And then he noticed the cells actually look happier than before. So it's the perfect environment for cells to be happy, to have the perfect environment, to be nice and moist with hyaluronic acid. And we're going to explain to you, and I'm going to show you with amazing split face studies, the evidence how this product is not just there for glowing the skin, reducing pigmentation, but to actually improve our laser treatments, all of our energy-based device treatment, actually all of our aesthetic treatments. So this is the first point that we have to start thinking whenever we attack the skin or the face, is we need to optimize. And this is the training that our cells need. It's got all the nutrients that our cells need. So it's optimal cell environment that's going to be the biohacking in the whole wound healing cascade. Next slide. So how does it work in this whole concept of the tissue response? So the signal quality is going to be controlled, that we don't have too much inflammation. The mitochondria, we want to make sure that it gets all the energy it needs. It needs the right ingredients to really optimally function. And we're also going to show you the evidence behind it. What does it actually do for the mitochondria and the ATP and the oxidation of the mitochondria? And then for the inflammation, very important, because we want regeneration, we don't want scar formation, and we don't want any pigmentation. Next slide. So Valerie is also very much in love with NCTF, and she also has a lot of experience with NCTF. So she's going to show us the latest data on NCTF and why is this product the optimal and the ultimate cellular biohacker for all of our aesthetic procedures.
Thank you so much, Ricky, for your brilliant presentation and introduction of why NCTF is the best biohacker and condition the cellular environment for the best regenerations. So we do understand now that NCTF, above the rejuvenation, is much more important in the extracellular matrix functional integrity, also to control inflammatory and redox homeostasis, and also to control and maintain metabolic competence of the cellular environment. And we do know since a long time that it really creates optimal environment for the cellular activity and much more. Next, please. So, BIOHACK NCTF 135 AdShare is a platform of 60 fundamental ingredients, and we split them in 4 categories. For cellular energy and metabolism, you will find the vitamins of group B, 8 vitamins, 6 coenzymes, and 6 minerals. For fibroblast functional modulations, we'll find vitamin E and the free uric acid. For redox and inflammatory balance, we'll find 4 main antioxidants, vitamin C, vitamin E, and glutathione. And to increase protein synthesis capacity, in this formulation we'll find 24 amino acids and 5 nucleotides. Next, please. And now, as Ricky presented, how much it is important to maintain the good energy of the mitochondria, we have this latest in vitro study concerning the basal respiration. And for this, there is 3 groups of cell: control, cell under fibroblast under stress that are deprived of nutrients, and then this same cell with NCTF 135HA. And as you can see, the fibroblasts under stress with NCTF 135HA present a basal respiration of their mitochondria at the same level of the control fibroblast. The second concerns the energy with the measurement of the ATP production. And here again, you can see that the fibroblast under stress with NCTF 135HA are nearly the same with significant comparison of the control cells. Then from the senescence, which is to gain longevity, you can see that the fibroblast under stress plus NCTF are much above the control fibroblast and less, of course, than the fibroblast under stress. Next, please. Another study, very interesting, to show how it is important to control inflammation, is this study, in vivo study of human skin model, when we make a dosage after injection of NCTF of these 3 inflammatory parameters. You can see that on histamine with NCTF 135HA, histamine level decreased by 28%. Interleukin 8 dosage decreased by 35% versus the control skin implant. And TNF-alpha decreased with NCTF 135HA by 38% control the skin implants. You understand why after a BD and lasers, how it is important to repair and reduce and control inflammation with NCTF 135HA. Next, please. Then another very interesting in vivo human skin model response to measure oxidative stress markers modulations. The first one contained hydrogen peroxidase, and you can see that compared with after UV skin, the level is plus 747 persons, while the same skin implants with NCTF decreased by 30%. Then glutathione peroxidase skin explant increase after stress by UV by 90%, while the same explant with NCTF decreased by 34.5%. Then the carbonylate proteins increase on stress skin implant by UV by 37%, while decrease using NCTF by 16%. That's why another marker modulation of oxidative stress, which contributes to determine how NCTF belongs to the biohack. Next one. Another next one. Now, something's very important concerning regeneration. And Ricky, you've been talking about regenerative medicine. It's concerning everything about extracellular matrix regeneration. And here again, concerning the pro-collagen type 1, you can see that after UV stress, the pro-collagen decrease, while using NCTF, pro-collagen 1 increased by 18%, reaching the control skin. Elastin, also very important, increased by 91%, much above the control skin. Next, please. The fourth point, which is also very important on the biohack with NCTF 135HA, is the skin cell viability modulation. And here, of this experimental in vitro collagen culture model, we observed that both on keratinocytes viability and fibroblast viability, control versus NCTF versus two other competitive products, with NCTF 135HA, you increase viability of keratinocytes at nearly the same level of control, while on the fibroblast viability, you enhance by 100% much more than the control group. So all, next please, all this study clearly confirm how much the NCTF 135HA as presented Ricky optimize the cell viability and the longevity of the cells. Now, Ricky, time is yours to present all your split phase study using NCTF with different EBD, and let's start with NCTF plus non-ablative fractional lasers.
Thank you very much, Valerie. So yes, so the concept with these studies were that I actually wanted to do a split phase study, because now we see all this evidence of the studies on NCTF that shows that we can control the inflammation with NCTF. We can ensure there's pro-collagen 1 and elastin formation. We can ensure hydration with the hyaluronic acid that you've mentioned, which is very important in lasers. But does it actually really correlate to better results? So with most of these studies that I'm going to present, you'll see it's a split phase study. So this is the first one on non-ablative fractional laser. So 6 patients are used for the study, where we did a VISIA skin analysis, looked at the wrinkle size, pore size, texture, UV spots, brown, redness, and then the porphyrin count. You can go to the next slide. So basically what we did is day 0 is we prepared only one half of the face. So the right side of the face received NCTF 135HA. So if you've used the injectable NCTF 135HA, you would inject it. I'm going to show you with very beautiful videos how to inject it. If you have NCTF boost in your country, you would use either like a dermapen, mesopen type of device, or a roller device to use it for topical. So you prepare the face. So I did only the one side of the face, right side. Then on the 7th day, so a week later, we did the non-ablative laser on the full face, but only put topically the NCTF on, again, just the one side, the right side of face. And then 14 days later, so it's a week after the laser, again, the NCTF just on the right side that you are either going to inject or use topically with a roller or a pen. So the concept with this is that before the laser, we want to prepare and optimize the cells and hydrate the cells. Then we do the lasers and we give the cells the nutrition for the first phase, which is the inflammatory phase. So we give nutrition to control the inflammation and to hydrate the tissues. Then after 14 days, we re-give this NCTF product again to help for the proliferative phase where the cells start growing. And then we did the skin analysis. So we can go to the next slide. So with this is basically the video showing you can apply it with a roller. You can click next, and then we did the laser. And then immediately after the laser, we basically just apply the NCTF and it then penetrates into the cells. And you can really see good penetration of either NCTF 135HA or the NCTF boost. So this was the Fraxel dual laser. So it would be any one of your non-ablative fractional type of lasers. And this is the protocol that was followed. Next slide. So what we then saw on these patients with a split phase study is that we saw double the amount of wrinkle reduction on the side where NCTF was used together with a laser. So before, on the day of the laser, and then after, 5 times better brown spot improvement, 2.5 times or 2.6 times better texture improvement, and 1.4 times better pore improvement. And we can see this is just one of the 6 cases where we can see the untreated side at the top, that we can see obviously there's results from the fractional non-ablative laser, but on the other side, spectacular results that we can really see almost all the wrinkles around the eye is gone. The brown spots is better, the texture looks better, the skin looks even more glowing than the other side. So this really confirmed with non-ablative fractional lasers, NCTF improves the wrinkles, brown spot, texture, and pore improvement in patients. So really making it worthwhile. And we've got all the data on all these patients that will soon be published also. Next slide. Then on the next one that I did was the picosecond laser. So this is NCTF together with picosecond laser because I have also a picosecond laser. And what we did with these patients, the same protocol where the right side was prepared with NCTF, then we did the laser, and that day of the laser, we apply topically on the right side, and again, 7 days after the laser, topical. So here we can see one of the candidates where we can really see a significant improvement. I think you can very clearly see 30 days later, the erythema, the difference, because this patient had a little bit of pigmentation and rosacea with really barrier dysfunction. And we can see in this patient the calmness of the skin, the inflammation is better. And what we saw also is obviously significant improvement in skin texture, significant more improvement in wrinkles, in the wrinkle reduction. The UV spot intensity was really significant differences, and also interesting, the porphyrin count improved. So it means that there's better control of the bacterial count in the cells. So really showing better results. And this is something that I did split phase, but I've actually been doing this combination on picosecond lasers for a very long time, especially in patients with very resistant pigmentation, because we get a lot of patients with that resistant melasma, and we don't get results when we start doing lasers because we cause too much inflammation. And when I started adding NCTF to my patients' whole treatment protocol, for the first time, I'm getting results on very resistant melasma and pigmentation. So this is a split phase study, but I've seen in practice also what I've done when I started incorporating. Next slide. Then we also did the split case study with NCTF and microneedling RF. So this would be any type of your microneedling RF devices, whether it's the Morpheus, the Secret RF, the Exion fractional RF, whichever microneedling RF device. So next slide. So same type of protocol. We did the Visia skin analysis for all the parameters before and then 30 days after the treatment. Next slide. And again, we did on the right side of the face, NCTF, then the day of the RF needling laser, the microneedling RF, we applied it topically because it really goes into those channels very effectively. And this has also been studied by Dr. Fariol and how well it's taken up into these channels. And then again, 14 days later on the one side of the face to help for the proliferative phase. So let's look at the results on the next slide of the microneedling RF and NCTF. And you can have a look at the pictures, even without looking at the percentages, where we can see the side treated with NCTF and the untreated side with microneedling. And you can actually see the whole eye. So the right side, the eye was actually more droopy than the left side, and the brow was even lower, and it looks even better on this patient. So texture improvement was significant, wrinkle improvement was significant. So really proving that microneedling RF significantly improves the outcomes of microneedling RF treatment. Next slide. Then a very exciting one is CO2 lasers. We know that there's quite a rebirth of CO2 lasers, even in very young patients that are seeing it on social media. So this was the most recent study that I did on split face with NCTF and CO2 laser. So next slide. So here again, I'll show you very nicely how we did the protocol. Next slide, please. So the same treatment protocol, intradermal injection of NCTF, then 7 days later, the ablative fractional CO2 laser, and then again, 7 days after the laser, we did again the one side of the face. And this is really based on the concept that this has already been published, and also the studies that have shown that hydrated skin responds better to CO2 laser than non-hydrated skin. So the first study that was published already showed amazing results. We can see it on the next slide, but then we also did the split face. So this was a study by Dr. Fariol and some of her colleagues showing 30% hydration improvement, 42% radiance improvement, and 20% improvement of homogeneity. So that's the pigmentation outcomes, better improved with NCTF. Next slide. So now I will present my 7 patients on fractional ablative laser treatment. The next slide. So same protocol, NCTF on the one side, fractional ablative laser 14 days later. Next slide, I can show you how we actually did it. So this was the injection technique that I used with a 32 gauge 4 millimeter needle. You could obviously also then use your NCTF boost with your pen or your needling device, or you could use the nanosoft or micronjet type of device, or you could use different type of needle techniques, whether it's epidermal, dermal, papules, whichever techniques. So remember, NCTF can be applied in many different techniques. So for this study, I did injection. Next slide. Then we did the ablative fractional laser on the full face of the patient. And then immediately after the treatment, we did a topical application. You can see that little white dots of the recently ablated skin from the ablative fractional laser, and then applying the NCTF. I have to tell you that the patients really found it very soothing. It wasn't burning at all, as we see with a lot of post-injection creams. They felt an immediate relief, and some of them were actually saying, can't you like secretly do it on the other side? We said, no, please stick to us. We need to see the results. And they were very surprised. So here we can see how the NCTF then penetrates into these microthermal zones that has also been shown to really very effectively penetrate into these zones to help with the initial inflammatory phase. And then afterwards, we're going to again do it in the proliferative phase. Okay, next slide. Then day 14, the patient comes back. We clean the skin nicely, make sure there's not any scabs left anymore. And then we accelerate the recovery and we kickstart the proliferative phase by again injecting with the NCTF, with either the needle technique or then with your NCTF boost with the needle roller or the meso or skin pen or derma pen type of device. Next slide. So the results was really amazing. So this is one of the patients' photos, but overall the results of all the patients together collectively showed 15.9% improvement in inflammation and bacterial control, 2.3 times better results on brown spots or UV spots, and that I think has got to do with the reduction in inflammation, as well as, remember, the high content of vitamin C and glutathione inside NCTF. On its own, it's shown to be helpful pigmentation. And in the majority of the patients, we actually saw 100% reduction in the brown spot count on the VISIA scores. So really showing spectacular results on the side that was treated with NCTF as well as the fractional ablative laser. Next slide. This is a male patient that is 69 years old. That did also the fractional ablative laser, where we saw specifically in this patient 21% improvement in wrinkles, 3 times better results compared to the left side, and double the improvement in the brown spots. Next slide. So altogether, we see that there's significantly better wrinkle reduction on the NCTF and fractional CO2 laser compared to only fractional CO2 laser. You can see it's more than 4% improvement on the side. The hydration and barrier recovery was a really significant improvement, 10.8% compared to only 1.3%. And then the inflammation, so the redness of the skin, which is really important, controlling the inflammation, we saw a significant improvement of 58.6%, whereas only 44% improvement with just the fractional side. Next slide. So what we can see is the tissue conditioning really matters before and after the CO2 laser. Because first of all, we've got a better barrier recovery because we've got reduced transepidermal water loss. We're replacing the matrix with a hyaluronic acid, and we're also supplying the cells with a perfect condition that they don't have this barrier dysfunction anymore. Then very important, especially in my country where I have a lot of sun exposure on all my patients, we've got different skin types from the fairest to the darkest. We see a lot of pigmentation problems after lasers, especially after CO2 lasers. So now I know that I can treat even the darkest skin because I am in control of inflammation if we add NCTF. In very dark skin, I would usually do a slightly more intensive protocol of doing 3 sessions of NCTF before we do the CO2 laser to really ensure that we control the inflammation and we reduce this pigmentary response that we get after lasers. And you can also continue with more sessions in very high-risk pigmentary patients. We see optimized tissue response, and this is very important for older patients. And this I've really seen with older patients. We don't get good healing in older patients, but as soon as we add NCTF, we get really good healing in the older patients because we are giving the nutritions. Because remember, in older patients, the derma-epidermal junction is where we get transfer from nutrients from the dermis to the epidermis, and this flattens, and there's decreased circulation to the skin. So now we can, from the outside, add all these nutrients, and even in an old patient, we can get results on CO2 lasers. Next slide. So what we can really see is that we can have a significant impact on the tissue conditioning with the hydration and barrier recovery. So think especially of those patients with very sensitive skin, very dry skin, really that barrier dysfunction. Those patients, for the first time, you can do laser treatments because we're going to counteract this laser dryness and this barrier restoration. In patients with acne, we've shown that it improves the porphyrin count and we get really much more control of the bacterial load. So even in those patients, we don't have that flare-up of acne if you add NCTF. And then very important is with wrinkles, because now we know fractional CO2 is really amazing for wrinkles, but we can make sure that all of our patients get wrinkle reduction from a CO2 laser because NCTF on its own is also improving this wrinkle reduction. Next slide. So the nutrients is really important in this biohacking. The barrier support is really important. So, and this has got to do not only with your hyaluronic acid inside, but with all of the antioxidants that Valerie has mentioned, the vitamin E, that's really very important, the inflammatory balance, and also the depigmenting that we have on its own with NCTF controls this whole risk that we have with CO2 lasers of post-inflammatory hyperpigmentation and suboptimal outcomes. Next slide. So this whole sandwiching protocol where we treat the skin, but we also add NCTF is going to refine our results, give healthier skin, hydrated and clearer skin than just the laser treatment on its own. Next slide. So we know now that the techniques are standardized and we've got very good quality devices, but the healing depends on the tissue function or the status of the tissue. And the baseline tissue state influences the outcome of the laser. It even influences how deep the laser penetrates and how it scatters. So now we know we can have better absorption also of the laser beam. We get better scattering of it. And then very importantly, we know we're going to give those fibroblasts in the extracellular matrix everything that it needs to be optimal for tissue repair and remodeling. So it's like we trained our soldiers for the war, or we trained the athletes for the event. We are training the cells now with NCTF to be ready for whatever attack we're going to do with whichever energy-based device. Next slide. So the biohacking, I think, is totally redefined with NCTF. It actually comes from 1975, where it was actually really a cellular biohacker, but it was before its time because we didn't really have the term of biohacking. And now it's proven with all the studies and with the split phase studies that we can really biohack our aesthetic procedures with this amazingly totally safe product that we've seen results for many years, but now we know we can also optimize all of our aesthetic treatment results. Next slide. So for years, the progress was measured by the technique, and often we think it's the person that are doing the treatment. But now we know we can actually define our outcomes by the tissue conditioning, and we can even be assured of those really bad healing patients. And don't forget about the smokers. The smokers never have good results on lasers. So now for the first time, you can get results even on smokers because we are giving the nutrition from the outside, because every time they smoke a cigarette for 6 hours, there's no oxygenation to the cells. And often I would tell my smokers, they get penalties. They have to do 2 additional sessions to make sure that the laser outcome will be much better. So you have to especially add it even more in those type of patients, or the patients that don't get enough sleep or not eating their fruit and vegetables or too much stress. NCTF always has to be added. So the best is always to think of NCTF as an essential tool before you do any attacking treatment. Next slide. So I think now we are very open to take your questions, to hear what you've maybe experienced, or maybe if you have any questions on protocol or the devices, or who can you do it, or even on the studies. We're open for questions now. Valerie,
thank you so much, dear Ricky, for your brilliant presentation, your brilliant result of clinical study, split phase. And there is some questions also concerning the number of patients you involved in your different clinical study.
Yes, so the majority of the cases were anything between 5 to 8 cases. The CO2 fractional was 6 patients that we did split phase study on.
Okay, thank you. And also some question concerning which needle you use to inject 135 HA.
So usually I use a combination of the 30 gauge needle that's inside the box for epidermal, and then the 32 gauge I would use for the dermoepidermal junction of the papules, as well as for the intradermal. But you could also only use the 32 gauge needle. So I think whichever needle that is the smallest possible to not traumatize the skin and obviously for the most comfort for the patient.
Okay. And another question concerns your experience or study concerning NCTF plus AM phase.
Plus M phase.
Yes, M phase.
Yeah, so M-Face is not an ablative device, but it works on the concept of muscle stimulation and radiofrequency. Radiofrequency also is very dependent on hydration levels. We know that if it's a very dehydrated tissue, we don't have optimal penetration of radiofrequency. So for any type of radiofrequency device, NCTF is really good to prime the skin before you do that. The rest of the M-Face works a little bit deep on the muscular level. So we're not really going to work on the muscles with NCTF, although I'm starting to think a little bit more of using it also for the muscles and see what it does. But it's definitely going to help for the radiofrequency part of your M-Face treatment.
Thank you, Ricky. There is another question concerning the quantity you used in the split phase study. Was it a full vial of 3 ml? And usually, what quantity do you recommend for the full phase preparation before a BD?
So usually what I would do is I would do 3 milliliters for the full face and 3 milliliters for neck and décolleté. That has always been my standard protocol. So in the split face studies, we used 3 milliliters in the split face study on the face and the neck because most of the patients also had neck treatment done, although the Visia skin analysis doesn't show the neck area.
Okay, thank you, Ricky. There is another question concerning the efficiency of NCTF about melasma and what will be exactly your protocol recommended in terms of number of sessions and space out on how much time?
So NCTF is so important in melasma because it controls the inflammation before you do peels. It controls the inflammation before you give depigmenting agents that might be aggressive on the skin. It in itself, it improves the whole cell biology, and we know melasma is actually an inflammatory condition because in who do we see melasma? We see melasma in patients with hormonal imbalances, in patients that are maybe exposed to steam, that we often see in patients working in kitchens and so on, that too much inflammation or excessive sun exposure. So by using NCTF in your melasma protocols, whether you are doing peels for it, whether you are doing lasers for it, it is so essential. And this I've seen more than 15 years ago that I struggled with melasma. We've got lots of melasma in our country. I couldn't get results, and I started adding NCTF to all my melasma protocols, and it totally made the biggest change ever. So with melasma, the more, the deeper the melasma is, the more intensive your sessions you need to be. So as soon as it's gone to dermal melasma, that we get leakage of the pigmentation into the dermis, you need a little bit more aggressive. You would look at least 10 sessions. If it's still epidermal, we actually see quite quick results with NCTF and some very soft peelings to get that exfoliation of the melanin in the keratinocytes. But dermal melasma, or maybe melasma after a patient has done a lot of other treatments where they burnt, needs a little bit extra sessions to really get to that dermal level and to recover the dermis cells.
And you spaced each session about 3 weeks?
Yes,
1 month?
Yeah, usually practically 3 to 4 weeks apart. Yeah, because you can do it closer together, which I mostly do if somebody's got a function and they want to like really look very good very quickly. But I think practically for patient, it works quite well to say, okay, every 3 to 4 weeks.
Okay, and once you've controlled your melasma, do you ask your patient to come back regularly every 2 months?
For maintenance, yes.
For maintenance?
Then I tell them anything from every 2 to 3 months, and try not to wait longer than 4 months for the maintenance sessions.
And do you have some special injection technique if it's some deep melasma?
So if it's deeper melasma, you need to make sure that you also use intradermal technique, but not subdermal. And I think that's quite important because a lot of doctors do the techniques of like the traditional mesotherapy terms that they use, and they think they are doing it, but they're going subdermal. So it's very important to make sure that you're intradermal with your injections if you want to target the dermis. Subdermal, it's also got benefits on the hypodermis, but to treat dermal pigmentation, you need to be in the dermis. So it means that you need to actually see blanching, and the most ideal is to see a papule. So to really make sure that you're intradermal, then you're going to target that dermal pigmentation.
Okay, I have another question, Ricky, concerning the use of NCTF in acne protocol. When you mean acne protocol, maybe it's acne scars, I think.
Yes, for acne scars, it's also very good that you can use it with either the needle technique, or I like microneedling very much for acne scars. For acne itself, it's also very nice because it reduces the inflammation. It helps to support the cells, and you can obviously combine it with whichever protocol you're treating acne, whether it's mild, moderate, or severe acne. The nice thing that I also like is even in severe acne, even if you're using oral isotretinoin, NCTF is even safe because it helps to control that really flakiness, the redness, the inflammation of the skin. But sometimes their skin is very sensitive. So you either need to use like really like a 33 gauge needle, or then maybe rather do it with a very short needle roller, like a 0.25 millimeter roller, because often the skin is very oversensitive for injections. Then I would do it that way. But it really helps a lot for the relief and during acne treatments.
Okay, two more questions. One question, is it normal to feel a strong burning sensation during the protocol, during the injection?
No, NCTF doesn't burn at all unless you're mixing it with something. NCTF is the one product which I've always said that is why it's anti-inflammatory, because it doesn't burn. A lot of competitor products has got a burning sensation. NCTF does not burn at all. So if the patient is feeling burning during injection, you are either using a very cold product, which could probably burn a little bit, that it was in the fridge very recently, or that you may be injecting too fast, too quickly, or that they're feeling more the needle. But the product itself does not burn. And we see that from the studies also, where it shows the effect on the interleukin, the histamine response. So it's not a product that should burn at all.
Okay, so concerning your injection techniques, which is something very important, when performing nappage, do you maintain injection points spaced about 1 centimeter apart?
Yes, so usually with epidermal technique, that's a very fast Parkinson's movement, which I always love because I think epidermal gives us really very, very nice glow. Epidermal is very close together, usually like less than 1 centimeter apart. Then the typical nappage technique is more your intradermal type of technique, or multi-puncture technique, or referred to as the technique of nappage. That's usually around 1 centimeter apart. But remember to keep the needle 45-degree angle and not 90-degree. Because if you're going to go 90-degree with a 4 millimeter needle, you are subdermal. And if you want to target the dermis, you need to be intradermal. That's very important with a technique.
It remember me, dear Ricky, you've published a very nice,
yes.
You remember bioengineering? It
Yes.
was also with Carol Desmet.
Yes.
It was about 7 years ago. Yes, and we should send you the reference. Maybe you know it by heart. It is bioengineering. It was published in 2018, I think.
Yes, it's available on ResearchGate free of charge, or even on PubMed. It's bioengineering, and I am busy rewriting the article just to bring in a little bit of the new technology and new types of needles and devices. So I am busy revisiting that article again.
Great. Ricky, thank you so much. You have many congrats for everybody. Honestly, it was really very interesting. We do have some requests if it's possible to have a podcast about it. And thank you for all our attendees to be with us. And please, before to leave, can you rate this session by following the QR code? And it will be our pleasure to see you soon. And soon mean next week on the 24th, Tuesday 24th, you will have the second session about all this fantastic study and series about biohacking. And here it will be NCTF with surgery, and we will be very pleased to welcome our dear colleagues, Dr. Rodriguez, Jacqueline from Brasilia, and Dr. Hossein Abou-Khalil from Lebanon. So, dear friends, thank you very much to be with us. Do not hesitate to come back if needed with some requests. Dear Ricky, thank you very much for your generosity to share all your data. Thank you and congratulations for your fantastic job. And is it possible to do a protocol with chemical kill? Of course, it was the latest question. Bye-bye, namaste, thank you everybody, and thank you FieldMail team to support all this webinar for a better medical education. Thank you.
Thank you, Ricky. Thank you, Val.
Thank you, everyone. Thank you.
Bye-bye. Thank you.
So see you next week on Tuesday 24th. Bye-bye.